Hello everyone. This is Nash here. I'm here with an OET speaking roleplay for nurses. Watch the video. Here's the roleplay card for you. And I'll give you 3 minutes to prepare. After that, just continue watching the video, and you will be able to practice the roleplay. And, at the end of the video, you'll get a complete version of the conversation. So start preparing. Your preparation time is over. Now let's speak. We'll play the interlocutor's part of the conversation. And you can add the nurse's part accordingly. Don't worry if you can't catch up or manage time. You'll be able to do that with practice. And at the end of this video, we'll provide you a full version of this conversation. So, let's speak.
Good evening. Sure, no problem. I am getting better now. But it was really scary. I couldn't breathe when I had the allergic reaction. Now, my breathing is getting a bit easier, but I really have a bad headache. Okay, thank you, nurse. That sounds like a good idea. Yes. How long I will need to stay in the hospital? All right. Yes, nurse, I understand you. But I'm so worried, because I fear that my chemotherapy treatment will be affected again. Yes, nurse. But now I'm really concerned about something else. I was only supposed to be in hospital for a few hours, so my family is going to be expecting me home, and they'll be worried if I am late. That will be a great help, nurse. Yes, if you don't mind. I am very hungry, as I haven't eaten anything since early this morning. Yes. Thank you, nurse. No, nurse. Sure, nurse. It's fine to do the clinical observations. You may please proceed.
I hope you performed well. So now listen carefully to the conversation.
As per the question, the patient is admitted to the hospital ward following an allergic reaction that happened in an outpatient clinic. So it's a known case, and since the name is not given, and gender is not specified in the background information, you need to ask the interlocutor for a name during the preparation time, and assume the interlocutor's gender as the gender of the patient. So here, since I'm female, you can assume the patient is female. And the name that I give is Rachel. So listen to the conversation.
Good evening.
Good evening.
My name is Nash. I'm a registered nurse working in this hospital ward. I'm the assigned nurse for your care, and I'm here to do some clinical observations, such as to take your body temperature and check the blood pressure. Are you okay with that?
Sure, no problem.
Thank you, Rachel, but before moving to that, may I know how you are feeling right now?
I am getting better now. But it was really scary. I couldn't breathe when I had the allergic reaction. Now, my breathing is getting a bit easier, but I really have a bad headache.
I can imagine how difficult that must be for you, Rachel. But there are several possible reasons for the headache. It might be due to dehydration, or exhaustion, or even it can be the after effect of the allergic reaction.
Okay.
But don't worry, Rachel. I can provide you some medication for relieving the pain. Besides that, I'll provide you a cup of tea, and that will surely make you more comfortable. How does that sound to you?
Thank you, nurse. That sounds like a good idea.
So is there anything still bothering you?
Yes. How long I will need to stay in the hospital?
Your question is really understandable, Rachel. However, I am so sorry to say that I won't be able to answer your question about discharge, as it is the doctor's decision. Is that clear to you?
Yes.
And Rachel, it's possible that you may need to stay in the hospital for some more days. This is for monitoring you more closely, so that we can ensure that your condition is stabilized.
All right.
During your stay here, we'll be monitoring your breathing, amount of oxygen in your blood, blood pressure, and temperature. So, the doctor's decision is vital. Did you get me, Rachel?
Yes, nurse, I understand you. But I'm so worried, because I fear that my chemotherapy treatment will be affected again.
Rachel, I admit your concern about another allergic reaction. But please don't be overly concerned about that. Because, there are several ways to deal with an allergic reactions, such as alternative chemotherapy drugs, immunotherapy, slower delivery of treatment, and so on.
Okay.
So, no need to be anxious about it. And more information about such treatments will be provided by the doctor. Are you able to understand me?
Yes, nurse. But now I'm really concerned about something else. I was only supposed to be in hospital for a few hours, so my family is going to be expecting me home, and they'll be worried if I am late.
Yes, you are absolutely right, Rachel. I will contact your family straight away after the clinical observations. I'll inform them of your current situation. And if necessary, I'll arrange for a visit or an overnight stay.
That will be a great help, nurse.
So, is there anything else I have to do for you?
Yes, if you don't mind. I am very hungry, as I haven't eaten anything since early this morning.
Don't worry about that. I will check with the doctor about food, and will make necessary arrangements for that. Is that okay?
Yes. Thank you, nurse.
So Rachel, is there anything else to be addressed?
No, nurse.
So now, I need your consent to do the clinical observations. May I proceed with the procedures?
Sure, nurse. It's fine to do the clinical observations. You may please proceed.
Thank you for the permission. Thank you for the cooperation, Rachel. The clinical observations are over.
Okay.
Now I'll take these readings to your doctor for discussing further treatment. So please relax and take rest.
Okay.
Meanwhile, I'll bring you medicines and tea, and I'll make arrangements to contact your family. And if you need any assistance, kindly buzz me.
Okay.
Thank you for listening to me patiently.
Thank you, nurse.
I hope you understood the explanation. Subscribe to Let's Speak from Insight OET for more OET speaking content.